Hello everyone, welcome back to my YouTube channel, The Disease Decoder. And today our topic of discussion is tuberculosis. What's tuberculosis? Our main question in is first we must understand what's tuberculosis. Tuberculosis is an infectious disease caused by the bacterium Mycobacterium tuberculosis. Mycobacterium Mycobacterium tuberculosis. It primarily affects our lungs, and in that case, we say pulmonary TB. And but it can also spread to other parts of our body, including the kidney, spine, and brain. And in that case, we say it extra pulmonary kidney. Okay, TB is transmitted through airborne particles when an infected person coughs or sneezes or speaks. Now let's talk about the types of TB. As I earlier discussed, pulmonary TB and extrapulmonary TB. Pulmonary TB is the TB that affects primarily our lungs, and it's the most common form of TB. Pulmonary TB types of TB. Okay, I hope you are understanding what I'm saying. And it's the first type, and the second type is extrapulmonary TB. Extrapulmonary TB affects other organs outside the lungs, such as the lymph nodes, lymph nodes, our bones, joints, GIT, peritoneum, many things like that. Symptoms vary depending upon what kind of organ is affecting. And our third type is latent tuberculosis. Okay, latent tuberculosis, the bacteria remains in the body in an inactive state. The bacteria is present in the body but in an inactive state. And mostly the healthcare professionals are affected by it. Um and it has no symptoms, but as I said, it's present in inactive state. And our fourth type of tuberculosis is active tuberculosis. Don't go on the writing, I am focusing on describing things, so I hope you understand. The bacteria is active, as the name suggests, and it shows symptoms. And our fifth type is multi-drug resistant tuberculosis. Multi-drug resistant TB. Multi-drug resistant TB caused by the TB bacteria that do not respond to two most potent TB drugs, isoniazid and first I have to write isoniazid, and the second is rifampin. Two most common drugs used in the treatment of TB, and when the patient is don't respond to these two drugs, we say it multi-drug resistant tuberculosis. And now we have to talk about the risk factors of TB. We have discussed types of TB: pulmonary TB, extrapulmonary TB, latent TB, active TB, and multi-drug resistant TB. Now the risk factors are HIV. First risk factor is HIV infection. HIV infection. Weakened immune systems make individuals more susceptible And the second risk factor is close contact. Close contact, living with or being close to someone with active TB. And our third risk factor is substance abuse. Substance abuse. Drugs and alcohol abuse can weaken the immune system. And our fourth most common cause or risk factor of TB is malnutrition. Malnutrition. Inadequate nutrition reduces the body ability to fight infections. And our sixth risk factor is fifth risk factor is chronic conditions. Diseases like diabetes can increase TB risk. And our sixth risk factor is healthcare workers. As I earlier mentioned, latent TB is most commonly present in the healthcare workers. Um, health Healthcare workers. And our seventh common cause is smoking. Increases the risk of developing TB disease. These are the main risk factors of TB. Now we have to talk about the symptoms of TB. What are the symptoms of TB? I hope you are watching it in proper way. Symptoms of TB. Uh, the main classifications of TB are pulmonary TB and extrapulmonary TB. Pulmonary TB is a TB that mainly affects our lungs, and extrapulmonary TB is a TB that affects other sides, other organs of the body apart from our lungs. Now, the symptoms of TB that affect our lungs means the pulmonary TB. I mention here lungs means pulmonary TB is persistent cough, persistent cough. Our second symptom is chest pain. Our third symptom is coughing up blood. And our fourth symptom is fatigue. The patient is usually fatigued. And our fifth common indication in the TB patients is unintentional weight loss. Unintentional weight loss. And our sixth common symptom in pulmonary TB patient is fever and night sweats. Don't forget night sweats. It's the most common symptom in TB patients. And our last most common symptom is loss of appetite. These are the symptoms that appear in pulmonary TB, means the TB of our lungs. Now we have to talk about the symptoms of extrapulmonary TB. Symptoms other than lungs. Okay, in these are maybe there are enlarged lymph nodes, fluid around the lungs, and bone pain or we can say, and bone pain and joint failure. Um, Fourth common symptom is abdominal Abdominal pain. These are the symptoms in extrapulmonary TB. Now we have to talk about the management of TB. I hope the image is clear to you. Management of TB. Uh, First, we have to diagnose the TB. And what are the ways for diagnosis of TB is first TST, tuberculin skin test, tuberculin skin test to check TB infection. And second is chest X-ray to identify lung abnormalities. And our third is sputum smear microscopy. CO sputum smear microscopy. And fourth test is culture culture test to grow to grow and identify mycobacterium tuberculosis from a sample, from a given sample. Um, no, last but not the least, most common and important part of our video is treatment. What's the treatment of a TB patient? Um, there are some most famous drugs for the TB patients. And our first drug is isoniazid. Don't go on my pronunciation. That's why I'm writing here. Uh, how isoniazid work? It inhibits the synthesis of mycolic acids, essential component of the bacterial cell wall. And as it inhibits, uh, in that way, it inhibits the manipulation caused by the bacteria, Mycobacterium tuberculosis. And our second most common medicine is rifampin. Inhibits bacterial RNA synthesis by binding to RNA polymerase. However, what's the mechanism of rifampin? It inhibits bacterial RNA synthesis. And our third drug is ethambutol. It also works by affecting the bacterial cell wall. And our fourth most common drug is pyrazinamide. Zinamide. Pyrazinamides. How pyrazinamide works? It disturbs membrane transport and energy production in the bacteria. Now talk about the duration of treatment. Duration of treatment. Typically 6 months for drug sensitive TB, 2 months of inactive phase followed by 6 months of continuation phase. 6 months of treatment. 6 months of treatment uh, for TB normally. And now talk about the contraindications of these most common drugs. Um, Isoniazid is contraindicated in patients with severe hepatic impairment. hepatic impairment. And our second drug, rifampin, is avoided in patients with liver dysfunction. And our third drug is contraindication in patient with optic neuritis. Optic neuritis. And same, our fourth drug, pyrazinamide, is contraindicated in patient with severe liver disease. And what are you thinking about? Second one is, what's coming your mind? You are right. Gout. It's all about TB. We talked about what's TB. It's the infection of the lungs. What's the cause? Mycobacterium tuberculosis. And we classified it into pulmonary TB, extrapulmonary TB, latent TB, active TB, and multi-drug resistant TB. Okay. Then we talked about the risk factors like HIV infection, close contact, substance abuse, malnutrition, chronic conditions, healthcare workers, smoking, blah blah blah, everything like that. And symptoms are very important for diagnosis of TB patient. Persistent cough pain, chest pain, coughing up blood, fatigue, unintentional weight loss, fever, and night sweats. Night sweats. I am focusing on night sweats. Please keep it in mind. And loss of appetite. These are the extra pulmonary symptoms of TB. Management. We would first check if the patient is of a TB patient. If for the confirmation of TB, we say tuberculin skin test, chest X-ray, sputum smear, microscopy, and culture test. And at the last, we talked about the treatment of TB, four drugs and their contraindications. No, you are watching what I'm saying. Please ignore my pronunciation and my bad writing. I hope you understand. Uh, this is all about the TB. I hope you enjoyed the video. If you enjoyed the video, please like, subscribe, and don't forget to share with your friends for the enhancement of their clinical skills. Thank you. Bye bye. See you in the next video.